Good day everyone, especially to our esteemed instructor, Ms. Meljohn B. Dizon, and respected colleagues, Amiller Stanley Floyd, Fabilar Warren, Jaime Marjon, and myself, Jayan T. Banyas. It is with great honor that we present our research study entitled The Role of Dietary Fiber, Exploring the Health Benefits of Carbohydrates in Digestive Health and Disease Prevention. In this research, we explored how dietary fiber supports digestive health and lowers the risk of chronic diseases like type 2 diabetes, heart disease, and colorectal cancer. As modern diets contain less fiber, our study emphasizes its importance in strengthening gut microbiota, improving nutrient absorption, and reducing inflammation. We hope this contributes to a deeper understanding of fiber's role in public health. Introduction. Carbohydrates are vital biomolecules that perform numerous structural and metabolic functions within biological systems. As Su Feng et al. 2021 note, they are critical for forming extracellular matrices in animals and cell walls in plants and microbes, providing structural integrity and cellular cohesion. Beyond their mechanical roles, carbohydrates participate in central energy pathways such as glycolysis and the citric acid cycle, enabling efficient ATP production and energy storage. CADCA 2022. Moreover, their diverse structures support molecular recognition, acting as key mediators of cellular signaling, immune function, and even genetic expression through roles in nucleic acid synthesis. His and Azari 2020, FADA 2022. Among these carbohydrates, dietary fiber has been increasingly recognized for its role in maintaining digestive health and preventing disease. As highlighted by Barber et al. 2020, a decline in fiber consumption, especially in industrialized diets, has been linked to a surge in metabolic and gastrointestinal disorders. Dietary fiber supports regular bowel function, modulates gut microbiota, and facilitates nutrient absorption. Jill et al. 2021, Ahmad and Khan 2020. In addition, studies show that fiber lowers the risk of chronic conditions such as type 2 diabetes, cardiovascular diseases, and colorectal cancer by improving insulin sensitivity, reducing inflammation, and enhancing microbial metabolite production. Bolsiewicz 2023, Chan et al. 2023, Ayuneta Mendrikan et al. 2022. Research gap. Despite extensive evidence supporting the benefits of dietary fiber, current literature often addresses its effects in isolation, focusing on single disease outcomes or narrow population groups. Few comprehensive reviews integrate its multifaceted physiological roles, interactions with gut microbiota, and influence on systemic health outcomes. Moreover, emerging approaches in fiber supplementation and the development of novel fiber-enriched food products are still underexplored in relation to long-term health impacts. Research objectives. This study aimed to examine the role of dietary fiber in maintaining digestive health and reducing the risk of chronic diseases through an extensive review of existing literature. Specifically, this study sought to: first, analyze the physiological functions of dietary fiber in promoting digestive health and gut microbiota balance. This involves examining how fiber contributes to maintaining regular bowel movements, supporting the growth and stability of beneficial gut bacteria, and preserving overall gastrointestinal integrity. Second, evaluate the role of dietary fiber in reducing the risk of chronic diseases, including cardiovascular conditions, diabetes, and colorectal cancer. This focuses on assessing scientific findings that link fiber intake to reduce incidence of chronic illnesses through mechanisms such as improved lipid profiles, blood glucose regulation, and anti-inflammatory effects. Third, Investigate how dietary fiber influences blood sugar control, cholesterol regulation, and nutrient absorption. This aims to explore how fiber slows glucose absorption, lowers serum cholesterol levels, and enhances the bioavailability of nutrients, contributing to metabolic health. And lastly, examine recent advancements in dietary fiber supplementation and emerging dietary approaches that enhance health outcomes. This looks into innovations such as prebiotic fiber formulations, functional foods, and dietary trends that emphasize fiber enrichment to promote long-term wellness. By addressing these objectives, this study aims to contribute valuable insights into the significance of dietary fiber in promoting overall well-being and preventing nutrition-related illnesses.
Discussion and analysis. Building upon the insight presented in the previous chapter, this section provides a structured discussion of dietary fiber's role in digestive health and chronic disease prevention. Through an analysis of review literature, this chapter examines the broader implication of dietary fiber consumption, including its physiological effects, impact on disease, risk reduction, and potential dietary applications. By synthesizing and interpreting existing studies, this discussion aims to highlight key findings and their relevance to health and nutrition. First is physiological function of dietary fibers in digestive health. How dietary fibers support gut microbiota balance and promote beneficial bacteria. So dietary fibers plays a foundational role in sustaining gut microbiota balance by selectively stimulating the growth of beneficial bacterial population, thereby contributing to digestive health and nutrient assimilation. As Bandifute emphasized, the gut microbiome regulates energy extraction and nutrient availability, suggesting that fiber-mediated modulation of microbial composition represents a promising strategy for mitigating malnutrition and metabolic dysfunction. Its role in digestion, nutrient absorption, and intestinal motility. The physiological effect of dietary fiber on digestion and absorption are well substantiated in the scientific literature. Affirm that fiber promotes the products of SCFAs, which facilitate nutrient absorption by supporting gut epithelial health and promoting anti-inflammatory signaling. In contrast, protein fermentation in low fiber diets can yield detrimental byproducts, illustrating the importance of dietary balance for microbiota driving metabolic regulation. Influence of their on reducing constipation and maintaining bowel health. One of the most well-established benefits of dietary fibers lies in its ability to promote bowel regularly and alleviate constipation. Emphasize that fermentation of dietary fibers leads to SCFA production, which supports metabolic regulation, strengthens gut barrier integrity, and enhances immune modulation, all essential for digestive stability. Second is dietary fibers' role in chronic disease prevention. Analysis of fibers' impact on cardiovascular disease prevention through cholesterol reduction. Cardiovascular disease, or CVD, continues to be a principal cause of mortality worldwide, with dysregulated cholesterol metabolism playing a central role in the pathogenesis. As the one explained, the accumulation of cholesterol ester within macrophages contributes to sclerotic plaque formation, ultimately accelerating vascular damage. Effects reduction of low density lipoprotein cholesterol has thus become a cornerstone of preventive cardiology. Third is dietary fiber's influence on metabolic health. Regulation of blood sugar levels and insulin response in fiber-rich diets. The metabolic benefits of fiber-rich diets are well established, particularly regarding glycemic control. A firm increase fiber intake consistently correlates with improved glucose metabolisms across diverse population, including those at risk for or diagnosed with diabetes and GDM rather. Effects of fiber on cholesterol absorption and lipid metabolism. So, cholesterol homeostasis is governed by a complex network of genetic and metabolic regulators as noted by Kumar. Key transcription factors such as SREBP and lipid regulating proteins like CETP, PCSK9 and CYP7E1 represent targets for cholesterol lowering intervention. How fibers affect nutrient availability and digestive enzyme activity. So in addition to modulating blood glucose and cholesterol levels, dietary fibers plays a key role in nutrient digestion and enzymatic regulation. Investigated how micronutrients such as fiber, vitamin D, zinc, and magnesium influence inflammation and oxidative stress and propose potential epigenetic mechanism underpinning diet microbiota interaction. Fourth, recent innovation and dietary approaches. Advancements in fiber-enriched foods and supplements for health improvement. Recent innovation in fiber-enriched functional foods and dietary supplements have shown measurable benefits in metabolic health, maintenance, and chronic disease prevention. Emerging dietary approaches that incorporate optimal fiber intake for disease prevention. So, in light of mounting evidence on fiber-broad health benefits, contemporary dietary recommendations increasingly advocate for higher fiber intake as preventive measures against chronic disease.
Summary of findings. Number 1. Recap of dietary fibers' role in digestive health and gut microbiota balance. Findings affirm the critical role of the dietary fiber in supporting, maintaining, and gut microbial equilibrium. Its fermentation by commensal bacteria yields short-chain fatty acids, SCFAS, including acetate propionate, and butyrate, which contribute to gut barrier integrity, nutrient absorption, immune modulation, and energy metabolism. The solubility and structural characteristic of the dietary fiber determine its fermentability and influence on microbial diversity and SCFA output. Low fiber intake was found to correlate with reduced microbial richness, heightened intestinal permeability, increased inflammation, and greater sustainability of metabolic dysfunction. Conversely, higher fiber consumption enhances microbial composition, reinforces intestinal integrity. and promotes systemic immune responses mechanisms closely associated with chronic disease prevention. Although mercury beta mediated effects are well documented, that terry fiber also exerts mercury beta independent actions by directly interacting with epithelial and immune cells. These findings underscore fiber's multifactorial contributions to digestive health, while also acknowledging that individual responses may vary based on fiber type and baseline microbiome composition. Summary of findings number 2. Overview of its impact on chronic disease prevention, including cardiovascular health and diabetes management and colorectal cancer protection. Evidence consistently demonstrated that dietary fibers plays a pivotal role in the prevention and management of the chronic disease, including cardiovascular disease, CVD, type 2 diabetes, and colorectal cancer, CRC. Soluble and insoluble fibers sourced from fruits, vegetables, whole grains, and legumes were associated with reduced disease incidence, improved metabolic markers, and decreased all-cause mortality. Mechanistically, dietary fiber aids glycemic regulation by showing carbohydrate digestion and absorption, thereby attenuating postprandial glucose fluctuations and enhancing insulin sensitivity. Notably, soluble fibers such as beta-glucans and psyllium were particularly effective in reducing HbA1c and mitigating the risk of gestational diabetes. In the context of colorectal cancers prevention, fiber-rich diabetes were linked to lower CRC risk, especially for distal colon and rectal cancers. Specific fibers such as inulin and cellulose demonstrated anti-metastatic properties mediated through gut microbiota modulation and ECFA production. Additionally, fiber supported colonic function, microbial balance, and immune regulation, reinforcing its protective effects. These findings confirm that dietary fibers' broad role in the metabolic regulations, gastrointestinal integrity, and long-term health promotions. Summary findings number 3. Summary of fibers' effects on blood sugars regulations, cholesterol metabolism, and nutrient absorption. The study confirmed that dietary fibers exert sensitivity benefits of thus stabilizing blood glucose level, improving lipid profiles, and enhancing nutrients absorption. By dialing carbohydrate breakdown, the glucose uptake fiber intake contributes to lower fasting glucose and HbA1c levels across diabetic, pre-diabetic, and GDM-prone populations. SCFA generation further modules insulin secretion and satiety hormones, offering additional glycemic control. Summary: in lipid metabolism, fiber reduces essential cholesterol absorption and promotions by acid excretion, resulting decreased LDL cholesterol and improve cardiovascular markers. The molecular regulation of lipid phospholipids via dietary fiber complements endogenous pathways influenced by transaction phase factors and influence modulators. Additionally, dietary fibers influence gastrointestinal transit enzyme activity and muscle cell mucosal development mechanisms, and enhance nutrient bioavailability. This affects substantiate fibers' integrated role in maintaining metabolic efficiency and preventing nutrition-related illness. Summary findings number 4. Key advantages of the dietary fiber supplementation and emerging health approaches. Findings reveal that innovations, fibers, enriched foods, and supplementation have redefined fibers' role from the dietary bulk agent to the therapeutic toll in the preventive of the clinical nutrition. Functional fibers such as glyconan, pectin, and beta-glucan demonstrated efficacy in the reducing body weight, improving lipid metabolism, and lowering systematic inflammation, particularly when coupled with caloric restriction. Clinically, applications also extended to patients with chronic kidney disease with fiber intake was shown to reduce circulating uremic toxins and inflammatory cytokines. Emerging dietary approaches emphasize daily fiber targets aligned with the population specific health needs. Findings revealed that innovation of fibers in roots food and supplementation strategies have redefined fibers from role from the dietary bulk agent and the therapeutic toll prevention and the clinical nutrition. Functional fibers such as glucosamine, pectin, and beta-glucan demonstrated efficacy in reducing body weight, improving lipid metabolism, and lowering systemic inflammation, particularly when coupled with caloric restriction. Clinically, application also extended to patients with chronic kidney disease, where fiber intake was shown to reduce circulating uremic toxins and inflammatory cytokines. Emerging dietary approaches emphasize daily fiber targets aligned with population-specific health needs.
Conclusion: this study explored the modified role of dietary fiber in promoting digestive health and preventing chronic diseases through an in-depth review of current literature. Findings confirm that dietary fiber, particularly through its fermentation into short-chain fatty acids (SCFAS), exerts broad physiological benefits, enhancing gut microbial diversity, supporting immune functions, modulating metabolic hormones, and improving nutrient absorption. These effects were found to vary depending on fiber type, solubility, and individual microbiome composition. Recommendation: in light of this evidence synthesized in this study, the following recommendations are proposed to enhance public health strategies, individual dietary practices, and research advancements related to dietary fiber intake. First, integrate fiber foods and daily dietary guidelines. Health practitioners and policymakers should reinforce consumption of fiber-rich whole foods as fruits, vegetables, legumes, and whole grains in national dietary frameworks. Public health education must emphasize a minimum daily intake 25 to 35 grams, adapting guidelines to specific demographic and health profiles. Second is promote personalized nutrition enforced by microbiome insights. As individual responses of fiber vary, future dietary counseling should integrate gut microbiome prompting to tailored fiber recommendation. Personalized nutrition platforms should leverage microbiome data to enhance efficacy of dietary interventions and chronic disease prevention strategies. Third is expand use functional fiber supplements and clinical population. So healthcare professionals may consider prescribing functional fibers such as petroleum D, glucans, and pectin as adjunct therapies for managing hypertension, diabetes, CKD, and gastrointestinal disorders such as invention should be supported by dietary monitoring and individual adjustment for support innovation in fiber-enriched products and packaging. So food scientists and industry stakeholders should continue developing products. These innovations serve both nutritional and environmental goals and offer sustainable solution of global dietary challenges. 5 is encourage long-term mechanisms focused research. Researchers should prioritize longitudinal studies that examine the dose-response effects of different fiber types on metabolic biomarkers and microbiota profiles. Additionally, investigation into fibers' epigenetic effects and microbiota-independent pathways will further illuminate its complex biological
This
roles.
research endeavor would not have been possible without the collective efforts and dedication of everyone involved. I extend my heartfelt appreciation to myself and my group mates for our spirit of collaboration, knowledge sharing, and mutual encouragement. Your cooperative thoughts and shared determination brought this project to life in the most meaningful way. We would also like to express our deepest gratitude to our beloved instructor, Miss Miljaun B. Dizon, for her unwavering guidance, understanding, and boundless patience. Her kind support and open-mindedness have inspired us to push forward and strive for excellence in both our work and our growth. Lastly, we offer our utmost thanks to God Almighty, whose grace and strength carried us through every step of this journey. His constant presence has been our anchor in moments of challenge and triumph. We are truly blessed and grateful for His enduring light in our lives. And that's all. Thank you so much.